Good afternoon, everyone, and welcome to the Masters of Science Programs webinar for Nutrition and Public Health Nutrition at Case Western Reserve University. My name is Jackie Davis, and I will be the webinar moderator for today. I'm the Education Program Manager within the Department of Nutrition. And our agenda for today will be a panel introduction, program overview, curriculum and course options, followed by research opportunities, professional development, and student outcomes from our department. And then we were lucky enough today to have two students join us as well who are currently going through both of our programs, and they can give you a little bit of their student experience. We'll then follow up with an application process and any questions. Our panelists today are Dr. Hope Barkoukas. She is the chair of our Department of Nutrition, and she is also an associate professor with us. Professor Randall, who is an instructor, as well as the director of MS in Public Health Nutrition Dietetic Internship. And our two students today will be Mark Husaka, who is currently going through our Public Health Nutrition program and is a Public Health Nutrition intern. We also have Marie Belzile-Davidson, who is an MS in Nutrition candidate with us, going through our general MS program. And without further ado, Professor Randall, I'll turn over the floor to you to give a program overview.
Thanks, Jackie. Well, thank you for joining us, everyone. I hope it is nicer wherever you are than it is here in Cleveland today. It is rainy and dreary. So I hope you have wonderful sunshine wherever you are. So it is my pleasure to talk to you a little bit about our programs, but I'm going to start with some bragging about our School of Medicine at Case Western Reserve University. We are ranked #1 in Ohio and number 24 in the nation on U.S. News and World Report Best Graduate Schools for Medical Research in 2020. And this is not the first time that we've been ranked in these esteemed positions. So we are very proud to have students and faculty who allow us to continue these rankings year after year. So why study in one of our nutrition programs at Case Western Reserve? Well, I can come up with a lot of reasons, but here are just a few. One is our flexible curriculum. The MS in nutrition is slightly more flexible than the MS in public health nutrition, but both are very, very flexible and allow you to choose electives that match your interests. And we'll talk a little bit more about those in a few minutes. We have opportunities for cutting edge research. We have opportunities for community involvement. We have very small class sizes, so whether you like it or not, you get to know your faculty and they get to know you very well. And speaking of faculty, we have faculty who have won awards in their discipline, nominations and awards for teaching at the undergraduate and graduate level. And very honestly, we have faculty who really do enjoy teaching, which it cannot necessarily be said about every graduate program across the country. So I am very proud to have colleagues who enjoy teaching as much as I do. Go ahead, Jackie. Thank you. So there are 3 options for graduate programs that are affiliated or housed in our department. The first is our Masters of Science in Nutrition. This is focused on an in-depth understanding of nutrition's role in health and well-being throughout the life cycle. We also, I'm going to go to the far right of this slide next, we have our MS in Public Health Nutrition, and that focuses on health promotion, reducing the risk of chronic disease, and advancing the health of populations through nutrition. And then we also have our dual degree, which is an MS in Nutrition as well as a Master's in Public Health. And this focuses on the public health side of it, focuses on public health programs and policies, community health, as well as completing the coursework for much of the coursework for the MS in Nutrition. So you get kind of both sides there. So how do you decide which program to choose? Well, it depends on where your interests are. If you're interested in kind of the individual focus of nutrition being a clinical therapy, and you have intent on working in one of the healthcare disciplines, many of our graduate students go into medical school, PA school, become registered dietitians, then perhaps the MS in Nutrition is right for you. If you're more interested in that population focus, policy and advocacy, public health nutrition programs, community health programs, then maybe the public health side of things is right for you. But both programs are just grounded in the fundamentals of nutrition science, and both really prepare you for a career in healthcare. So let's talk about the core curriculum for both the MS in Nutrition and the MS in Public Health Nutrition. The MS in Nutrition is the most flexible because it has 2 required courses, Advanced Human Nutrition 1 and Advanced Human Nutrition 2. Advanced Human Nutrition 1 is energy and our macronutrients, as well as some of the minerals. And then Advanced Human Nutrition 2 is our vitamins course. Those are the 2 core required courses for the students completing the MS in Nutrition. Beyond that, you have to complete a total of 30 credit hours in the program, and at least 21 of those need to be at the graduate level in our nutrition department, but the courses that you choose are entirely up to you. For the MS in Public Health Nutrition, because of some of the competencies set forth in the public health curriculum, there are a few more required courses. We require Advanced Human Nutrition 1. We also obviously require a public health nutrition course, a nutritional epidemiology course. Because of the disease prevention component, we require diabetes prevention and management. And then because many of those who work in public health work with one end of the aging spectrum or the other, we require either our pediatric nutrition course or our course for older adults, nutrition for the aging and aged. Beyond the core courses, you have time for electives. And here are just a few of the opportunities for electives that we have available in our department, ranging from food behavior, nutritional biochemistry and metabolism, supplements, sports nutrition, integrative and functional nutrition, exercise physiology, pediatric nutrition. We have a variety of electives that will hopefully match your interests so that you can craft a program that really meets the needs of what you are looking to do educationally. So what would your life look like if you were going to complete one of these degrees? This is a plan if you were to complete either the MS in Nutrition, which is this slide, and then the next one is the MS in Public Health Nutrition. If you were to take a 1.5 or 3 academic semesters to complete the program. We have students who take 2 years. We have students who take a more rigorous approach and complete it in 1 year. But if you complete it in a 1.5 years, it gives you some time to do some extracurriculars, some volunteering, some research. And so that's the setup that we have here in front of you. So if you were to complete the MS in Nutrition, you would start in fall of 21 and take Advanced Human Nutrition 1 and a couple of graduate electives, perhaps fill in with research or an extracurricular activity. In the spring, you would take Advanced Human Nutrition 2, again, fill in with some electives, extracurriculars. And then if you are using our MS in Nutrition as the next step on your path to medical school, a dietetic internship, or a PhD program, you would probably want to start those applications and that process in the spring. And then in the fall, you could finish up with your graduate elective courses, as well as any extracurriculars that you're interested in. Jackie, I can't talk that fast.
I'm so sorry. I tried to unmute myself just to make the point that while this is just an example and that we do have a rolling admissions process that does allow you to start in spring, fall, and summer. So I was trying to make that point and accidentally jumped the gun a little bit. Sorry about that.
No worries. So if you were interested in the public health nutrition curriculum, again, as Jackie said, it doesn't have to start in fall. You can start in spring. But either way, you would have this kind of layout for 3 semesters. And I won't read all of this to you. You can take a look on your own. But again, if you wanted to condense it, you would just have a heavier course load in 2 semesters, about 15 credit hours, which is a heavy course load, but it's not impossible. And actually, our 2 students who are on can comment about that if they want to talk about what their course load has been like and how it felt with extracurriculars. Mark is in the dietetic internship, so it's a little bit different. But when we get to them chiming in, we can see how they feel about the course load. But again, this is if you were to spread it over 3 semesters. And now I will turn it over to Dr. Hope Barkoukas, who will talk about the opportunities to become involved with research in our department.
Thank you very much, Professor Randall. So Case Western Reserve University is known as a research institute. And so the beauty of being involved with any of the master's degree programs, the real beauty, as I said, is that you have the opportunity to engage in research and a wide array is open to you. For example, it could be in bench science. In other words, you identify researchers either within the Department of Nutrition, within the School of Medicine, or anywhere in the entire university and match your particular interests. And even if you don't have a heavy training in terms of some of the skills needed, many of the labs are willing to train. And so you can have research experiences in bench science very easily. We also recognize that there is research in the community as well as clinical. And so depending on your interest, you simply have to take the time to look at the list of faculty and find out what they are working on. So what you're seeing on the screen, if you just look at these for a moment, you're going to see the just enormous variation in terms of what we are talking about. Everything from, for example, the vitamin E and obesity-borne non-alcoholic fatty liver disease, that is involving bench research, trying to ascertain the various mechanisms at the cell level. Same with the structure in terms of modifying proteins. However, when you look at some of these others, for example, the diabetes-inspired culinary education, that DICE program is a community program in which our students are there learning just one-on-one how to actually interface with participants in those studies. And so that is really up to you. There's a lot of different ways to approach the research. One can either do this as a volunteer, coordinating with the faculty to make a mutual decision on how much time you as a student will spend, or you can take it for credit. We have credits, you can take up to 3 credits in 2 different courses. One is called 601 and one is 602. And so depending on the depth of experience and the depth of exposure, you have the opportunity to engage 4 credit hours for the entire duration of your program of education with us. We also pride ourselves in the fact that we really consider the holistic student, so that we have a variety of different resources, not only within the department, but within the entire university. And this is very important because it's not just about building your professional portfolio in terms of what courses you take and what research you engage in, but it's also really being honest. What are your strengths that you need to develop and how can you do that? And so with these different resources and student services, these become a situation in which you are able to engage. So we have everything from the GCA&D is the Greater Cleveland Association of the Nutrition and Dietetics Group. Those are professionals that work specifically in the field of dietetics and nutrition, and they're professionals all over the city that meet on a regular basis, and students can easily participate in this very worthwhile opportunity. I went through research. We have a very strong focus on pre-professional, specifically in the health areas. Obviously, we are a university in which a high % of students, their ultimate goal is to get into medical or dental or physician assistant programs. And so there are many opportunities to engage with experts who can guide you along the way for that. We definitely are very, very focused on building relationships, building not only advising, but mentoring. And there's definitely a distinction. Every single one of our students, faculty know, as Professor Randall humorously alluded to, if this is a place, if you're the kind of student that wants to hide and not get to know any of your faculty, this is not the school for you, because we care about our students. We want to engage them so that they can both personally and professionally grow. There are a lot of student organizations, and again, the focus is on caring about you as a whole person. What do we do, or what are the opportunities after graduation? And we are very fortunate in that the combination of the high quality courses, close faculty mentoring and advising, the research experiences, the numerous opportunities for development in the different organizations on campus translates into success after graduation, either via different dietetic internships, the next professional step, which could be, as I said, medical, dental, or PA programs, that's physician assistant programs. We also have a number of students who go back to school to continue, and they are involved in PhD programs. In fact, I just worked, oh my goodness, a week ago with one of the students I had probably about 8 to 10 years ago. She's been in the field working in dietetics all this time, and she is now going back to school. Easily called me because we've stayed in connection. And so it was very simple to write a recommendation for her. And so there are a variety of different routes, and we are the stepping stone to success in those. We wanted to give you some specific data points. We have a very high acceptance rate for students going into medical school as well as PhD programs. And again, it's because we do this individual focus, as I've now discussed with you. We have a very high placement rate for dietetic internship programs. Our average for 5 years is hovering at around 93%. That is contrasted to the national average, which is significantly lower at about 53%. Typically, the average student will take 1.7 years to degree. And I want to point out that this is really because of the students' choices for the number of credit hours they have elected to take each semester. In the Department of Nutrition, you will not get closed out of classes. And so time to finish, again, is based on your particular needs. Some will take it slower, and some will be able to finish in a year. As Professor Randall noted, it really is ideal if you can think about thinking of 3 semesters, because this allows you to fully immerse in the combination of program opportunities, research, as well as your classroom.
And here's where we will kind of touch base with our current students, Mark and Marie. As I stated, Mark is going through the public health nutrition program right now, while Marie is going with the general MS program. So Marie, could you start by telling us a little bit about your courses and how you feel working with the faculty?
Yeah, so like Jackie said, I'm Marie. I am taking 2 years to finish my MS in nutrition. This is coming up on my last semester because I also decided to do the didactic program in dietetics along with it, since my undergraduate degree was not in nutrition, because my goal is to become a clinical dietitian. And when I first met with Dr. Swain, who's another amazing person on the faculty, and Dr. Barkoukas, before I decided I wanted to apply for CASE, that all sounded very overwhelming to do both at once. But the fact that it is a small department, to me, it feels like a tiny little family. It was not overwhelming at all. I've taken no fewer than 3 classes each semester, and it's been totally manageable for somebody who's been out of school for 5 years before I went back to get my master's. Faculty is easy to reach by email. When we're on campus, they're always accessible in their office. I think I had a phone call with Dr. Barkoukas at like 7 p.m. one weekday night because she was helping me with my internship application process. So that's just a testament to how involved they all are with us succeeding. And that's one of the many reasons I chose CASE. Before I even applied, I could tell that they were very invested in us as students.
Hi, everyone. So I was in the dietetic internship, the combined program, the public health nutrition program, and my course load, it was to me, it was perfect. So last fall, I had 4 courses, and this year, along with the rotations, I have 2 courses in the spring and 1 course in the fall. And especially with a time like this with COVID, with Professor Randall being my internship director, she went above and beyond to make sure everything flowed smoothly. I put all my trust in her and everything went great. And I'm on course to graduate in just a couple of weeks. So my student experience at CASE, it's been unforgettable. I was born and raised in Hawaii, and I'm having the time of my life here in Cleveland. I've met many students from around the world, across the US, including Marie here, in which we had intro to public health nutrition together. So I enjoy that the number of students in each class is not too big nor too small. So this made it quite easy to be friends with the whole class. And so like one of the main things that I love about being a student here is that the faculty will just go above and beyond to make sure that you understand the content necessary in each course. And just like how Dr. Barkoukas mentioned about research opportunities, so as an individual that loves the science of nutrition, I have a fascination with the gut microbiome. So I applied to become a volunteer research assistant at the Division of Gastroenterology and Liver Disease at CASE. So during my time there, we conducted animal studies using mice, performed fecal microbiota transplantation experiments, and we fed the mice like a certain diet to look at inflammatory potential of inflammatory bowel disease. So this was a great experience because rather than just looking and reading through scientific literature, I was able to get hands-on experience and see exactly how the data of research comes together.
And just to talk more about the student experience, although obviously with COVID, it's a little different. I haven't had a single course where the instructor hasn't created some kind of either partner project, group project, or multiple class discussions. So I felt like within 2 weeks of starting the program, I felt a bit like a fish out of water day one, because I thought I was on the older end of people in the program, but we all became friends quickly. We've set up study groups. We text each other back and forth. I go on dog walks weekly with one of the other girls in my kind of little core cohort. So it's not just that you're close with the faculty, it's also very easy to be close with the other students. And the department set up things like apple picking last year. And here's an example of a Cavs game, just a lot of fun things, so that it's more than just, going back to school to get an advanced degree. It's also building a community and building connections that will last and help you with, getting where you want to be in your future career.
Marie, I'm just going to sneak in a minute. Could you also just say a sentence or two about your experience with the clinical research?
Yeah, no problem. So I'm still working on a clinical research project right now through the Cleveland Clinic, and we're looking at individuals with pulmonary hypertension and what the Mediterranean diet might do to help with their disease progression. And Dr. Barkoukas is actually the one that set me up with that. And it's been great because I've gotten clinical experience from a nutrition perspective in terms of counseling the research subjects, but the research team, it leads to more opportunities. The research team is like, hey, why don't you help us with the exercise portion too? And even though I'm not studying exercise science, like I'm getting to learn all these other parts that play into nutrition, but aren't directly nutrition. So it's been a phenomenal experience.
So currently I live just outside of Cleveland in a city called Westlake. So I've spent a decent amount of time in the city, especially in Asiatown, where they have some of the best Asian food I have ever eaten. However, Marie knows more about what to do in the city than me, so she will go over that with you in just a bit. So majority of my time is spent in areas that are roughly a 30-minute drive from CASE. And here in Westlake, we have an upscale open air mall called Crocker Park. There are lots of stores and restaurants to shop and eat there. It's beautiful during the winter months, just like now, where Christmas lights are lit all around. Just the other day, I went to Chagrin Falls, which is just about 30 minutes away from the CASE campus. And I was blown away by how gorgeous that little village is. I took pictures of their downtown and posted it all over my social media, saying that being there was like I was teleported into a Hallmark Channel Christmas movie. It's that breathtaking. Mm-hmm. So as I mentioned earlier, with me being from Hawaii, living here in Cleveland, to be honest, is better than living in Hawaii. Everyone that I have met around the city has been extremely nice. You can experience the 4 seasons, the food is fresh and inexpensive, and the healthcare system here is one of the best in the nation. So going into nutrition at Case and being in Cleveland simply go hand in hand.
So I am not from Hawaii, a little jealous of Mark. But I have grown up in the greater Cleveland area. I grew up in the western suburbs, and Cleveland today is unrecognizable from Cleveland when I was a little kid in a good way. It's kind of hit or miss downtown. There wasn't a lot to do aside from go to sporting events. But now there are so many fantastic restaurants. We have a great art scene. We've got Playhouse Square in the theater district. We have the Cleveland Orchestra. I mean, Severance Hall is within Case Western's campus, so a quick little walk over there. We have phenomenal museums. The people are really nice. I'd say we're like typical Midwestern nice, but above and beyond that, Cleveland's had to reinvent itself a few times, and the people here reflect that. They're just people that never stop trying. And the other awesome thing about Cleveland is that we're right on the lake, so you have phenomenal places to walk along Lake Erie, but also amazing metro parks. I've spent all of this pandemic going to different metro parks with my husband and my dog, and you still can't even touch on every single park that's available to you here in the greater Cleveland area in just a few weeks. So if you're an outdoors person, there's plenty to do here too.
And if I can just say too, with some of the pictures in the background, being a student here at Case Western also gives you free access to the Cleveland History Museum, Natural History Museum, the Cleveland Museum of Art, the Botanical Garden. You get discounted tickets to the orchestras and different plays that come into town. So there are a lot of ways to engage within the city, even at discounted rates. So thanks guys for talking about that for a little while. Mm-hmm. Next, we're just going to cover a little bit about the cost and financial aid options. Tuition here at Case is for the upcoming year, it's going to be $1,997 per credit hour of graduate level courses. Now that does top out at 12 credit hours. So if you were to take over 12 credit hours, you will be charged a max of $23,960 per semester. So anything after that, if you plan on trying to do it within a year, taking 15 credits and 15 credits, you won't be charged for 6 of those total credit hours. Types of aid that are offered, department assistant available. We try to give out a little bit of scholarship money to almost all of our students who apply here. We did increase that by over 50% in the last year, so that was really great. And outside of the department, our financial aid department at Case is really wonderful. They're very interactive with our students, and they can tell you about all the different options you might have. There are federal direct unsubsidized loans, federal direct plus loans, and private loans available. So if you're ready to apply or thinking about applying to Case Western, it's a pretty simple application process. You apply directly through our website and complete an online application. You submit your transcripts for your undergraduate coursework, and these do not have to be official. They can be unofficial for the application process. After you're accepted, that's when you would need to submit official transcripts directly to the Department of Graduate Studies. We require a personal statement, which is just a 1 to 2 page letter letting us know a little bit of information about yourself, what you've done in the past academically, what you're looking forward to doing in the future, and why you think our program might be a great fit for you. If you've done any previous research experience or anything that you think might bolster your application, please include that. You can upload whatever you'd like, but it is not required. We do require 3 letters of recommendation. We do prefer that these come from academic references. If you have been out of school for a while though, feel free to use business references, or if you've had supervisors for past volunteer experience, research experience, all of that is acceptable. We just ask for no personal references. If you are an international student and you have not studied previously at a university in English, we need you to submit a TOEFL or an IELTS score. And that's roughly it. If you feel that there's something, if you've taken an MCAT or a GRE and you have done exceptionally well and would like to submit those scores, again, you are more than welcome to, but that is not a required part of the application. So now we'll move on to what a time frame looks like. We do a priority deadline, which is February 8th. We try to turn around our applications as fast as possible. So once you've submitted your application, I will start tracking it within our system. Once we receive all components, so all letters of recommendation have been submitted and the application is complete, it will get pulled and reviewed within a few days, typically no longer than 2 weeks. So if you were to apply by February 8th and the application is complete, we will turn that around to you before March 1st, probably much sooner than before March 1st. Our standard application deadline is going to be April 15th. This is the date that I recommend international students who need a new visa apply by. After that, it does become very tight time frame for them to get that new visa processed. And our final deadline for application is August 1st. I don't ever recommend waiting until the last minute to apply, solely because if you're not local to Northeast Ohio and plan on commuting, it could be difficult for you to find housing, but that is our official deadline. Orientation for graduate students is put on through Graduate Studies, and that typically happens a week or two prior to courses beginning. And the first day of fall 2021 is going to be August 23rd. So I know that I've had some questions submitted. Dr. Barkugas, I talked to you about this a little bit. I've had students asking us if, right now we are pretty much entirely online, if we plan to keep that going forward in the future, and we'll offer both courses in person and online.
So I can say definitively that for spring semester, that will be the case. As far as moving to fall, which many of you are interested in, most likely we will be in a hybrid situation, that we will have the online or the remote opportunities, but also if we are in a position where health is stable, the pandemic is stable, we've got the vaccine, et cetera, then we would anticipate resuming our in-person traditional format classes. I can't exactly give you the specific percent, how many classes are going to be remote or online only versus in person, because our top priority is your health and safety. And so although we're lucky enough to live in Cleveland with the most amazing medical centers in the world, we still put that as our priority. And so it will depend on the ambient environment with respect to COVID as far as what our specific classes look like.
Thank you. I've also had a student ask if one of our students could describe a little bit about the course options and if they've been satisfied with the course options that have been offered and what classes they've possibly enjoyed.
I can answer that. So for the MS in nutrition, there's no lack of electives. There are so many options that I wish I could take them all. It's just not possible. So one that I'm taking right now is nutrition during pregnancy and lactation. And that one is absolutely fascinating. Didn't really think I had a big interest in women's health before taking that class. But that class has shown me otherwise. We do a lot of case studies. We do a lot of group discussions, some student presentations too. So it's not just, lecture and then take an exam. It's much more than that. I've also I'm taking it this semester right now, nutritional biochemistry, which, for me, biochemistry at first in my undergraduate degree was one of my more challenging classes. So it's like, why did I take nutritional biochemistry? But when you're at the graduate level, everything is even more focused on what you're studying. So it's all the more interesting. And that's another fascinating class as well. So you can learn things, from a bigger picture of helping a woman who is pregnant and to the, microscopic level of what things look like biochemically.
I'll also chime in there to sort of highlight what Marie just said. We have approximately two dozen classes at the grad level in the department. And we traditionally will offer them on a regular basis. You know, we do have the anomaly situation where if we have a faculty person who is on maternity leave or something like that, the class may not be offered a particular semester, and it's because we have the experts teaching the course content. We don't just switch around faculty just to make the class, you know, be available. We really stay focused on matching the instructor with their areas of expertise. But as Marie noted, we have a lot of different electives. And so the usual challenge or dismay that we hear from students is that they just don't have the time to take all of the classes that they want, as contrasted to not having enough options.
Thank you. The last question that we've been asked was, does going through either program guarantee me or guarantee you to get into an internship or med school? And the answer to that is no. You still do have to apply for med school, and you do have to apply for internships. There is no direct link.
And actually, I'll expand upon Jackie's excellent answer. Some students are confused because our particular department, the Department of Nutrition, is one of the 12 basic science departments in the School of Medicine. And so that is an advantage in the sense that you have very high visibility for students to engage with all of the different basic science departments, but that does not have any relationship, as Jackie just clearly stated, to your application. So that if you're interested in medical school or one of the other health areas or, grad school, et cetera, that is an independent step. But again, the whole point is that we have made you ready for that next step because of our focus on you as a whole student, as contrasted to just classroom activity.
And we do have a very high success rate of students accepted into those programs, as we've stated previously. Well, I don't know if our panelists have anything they would like to add additionally. If so, please feel free.
So this is Professor Randall. I will add one thing. I will comment that I am an alum of our undergrad and MS in Public Health Nutrition program, and feel that as a grad who has gone out and worked in a variety of settings in the community and then turned into a faculty member, I will tell you that I felt extraordinarily prepared when I started my career, perhaps more than some of my colleagues who were starting their careers at the same time, who had gone through other graduate programs. And if you're interested in dietetic internships, that also. So I think it gives you an excellent foundation. And that's not just because I am a faculty member, it's because I experienced it also.
Thanks, Professor Randall. Well, then I will go ahead and end this webinar discussion, but I just wanted to go ahead and thank all of our panelists for joining us today, and thank you for everybody who attended. If you have any questions or you think of anything later, please go ahead and direct those questions to nutrition@case.edu, and we will get back to you as soon as we possibly can. Thank you, everyone.